All right, hi, this is Jennifer Alessi. I'm performing task number 7, TPR and auscultation on a canine. I've got my tray of supplies assembled. We have a thermometer for the temperature, lubricant for the thermometer, stethoscope for me to listen to lung sounds and heart rate, and then calculator to help me with my 4-times table. All right, so first I'm going to go ahead and assess the patient as far as the behavior, temperament, coat, body score. Hey, the girl. Can you stand up? Good girl. So she is a little wider than she probably should be. So on a 9-point scale, I would rate her at about a 7. She's about 70 pounds. And then as far as her coat, she looks pretty good. She has a few skin tags that I can see. Her gait, if we can have her just walk really quick. She's pretty even as she's walking. I can see her front left paw. Her toes do splay out just a bit. She is 11. So she's looking pretty good for her age. All right, so I'm going to go ahead and have my assistant restrain. I'm going to check her perfusion first. So we are going to look at those mucous membrane colors. I'm checking to make sure that her mucous membrane is pink and moist. That would be normal. Hi, good girl, it's okay. So I'm going to go ahead and check that. I push with my thumb on her gum. Her capillary refill time is less than 2 seconds. Good girl. All right, there's that. So her perfusion looks good there. Now I'm going to go ahead and check her heart. I am going to check her heart rate using stethoscope. And then I'm also going to verify that pulse and heart rate with her femoral artery on her hind leg. And then my restrainer is going to restrain so I can listen to that. As I listen, I'm going to go on the left side. I'm listening for her pulmonary artery, or pulmonary valve, her mitral valve, as well as her mitral pulmonary aortic valve. On the right side, I'll listen for her tricuspid valve. I hear a really good thud. And then I'm going to check that femoral pulse, so back in her thigh. And I'm going to feel with just 2 fingers. And I can feel that right up there. There we go. Switch hands so I can check it against her heart. I want to make sure that heart rate and her pulse are beating together, which they are. All right, so I'm going to go ahead and count her thuds. With her panting, that does kind of change her respiratory rate and makes it a little bit more difficult to listen to her heart, but we're good. It's okay. 3. Let's see, I'm also going to use my watch and count for 15 seconds. There you go. Alright, so I had 25, so I'm multiply that by 4. I'm going to let her relax for a little bit before we check her lungs, just because that is a little long for her to be in that restraint, and I can tell by her panting. It is normal for her to pant during physical exams because she does get a little anxious. So 25 was the beats in 15 seconds, so 25 times 4 is 100. The normal range for a dog is about 40 to normal pulse is about 60 to 180 beats per minute, so she's well within that normal range. Again, respirations, she is panting, so that does kind of affect the respirations, but if we can calm her a little bit, I'm going to be physically looking to see that inspiration, expiration in her abdomen. I can hear with the pant, and then I can even kind of palpate and feel that going on. So I'm going to try to count her pant in that 15 seconds. So I'm going to start now. Alright, we got about 30. So it'd be 120 for that respiration, which is definitely on a high end. Normal with respiration is about 10 to 30. So she is high given that she is panting right now. But again, not worried about it as that is her kind of normal behavior. Alright, so we did her temp, we did her pulse, we auscultated the left side of her heart. I need to check her right side or her tricuspid valve, so I'll go ahead and do that. And then I'm also going to listen to her lungs. So I'm just going to come in on the right side, and I'm going to listen for about a minute, and just making sure that I'm not hearing too much pressure or kind of strain there. And as I'm listening, I am kind of just moving around just a little bit to get some different angles. Good girl. Okay. Good girl. Good girl. Alright, and now I'm going to go ahead and listen to those lungs, and I am going to do a 9-point pattern since she is so large. Again, I'm going to listen both cranially and caudally. Everything is sounding pretty good. Not too raspy. And then I'll move her on the other side. Good girl. Alright. And then again, that same 9-point pattern. Good girl. It's okay. Good job. You're okay, baby. Good girl. Alright, so we're going to go ahead and take a breather while I get the TPR temperature set. So I have to lube our thermometer because we are going to take a rectal temperature. So I've got our rectal temperature, our thermometer, and then our lubrication. I'm going to make sure that I do not put the thermometer inside of the tube. I do have paper towel down here as well. So I'm going to apply lube. And then just make sure that I've got lube on the thermometer. Turn it on, going in. Insert into the rectum. All right, and her temp is 100.9, which is absolutely in normal range. So normal is 99.5 to 102.5. So we have completed our TPR. We checked her perfusion rate, it was normal, pink and moist, mucous membranes with a CRT less than 2. Her respiration was 120, again she is panting. Pulse was 100. Her heart rate did match with her femoral artery. And her temperature was normal.